Hello everyone, good afternoon. Welcome to Akoko Africa Radio UK. You are welcome to Health Talk with Atswei. And today we are lucky to have Reverend Dr. Sasu to come to talk to us about pediatric disease, kidney disease. I hope you make time and stay with us, and I hope you are going to gain something good out of it.
Join Atswei on the Health Talk Show. Listen every Saturday from 4 p.m. to 5 p.m.
Please, when you get the link, share it and tell a friend to come and listen. If you don't have enough time to listen, you can always go back and listen to it on our platforms, YouTube, Facebook, and on the radio website.
Health Talk Show with Atswei. Your health, our priority.
Hello, listeners. We now have Reverend Dr. Sasu on the line here, all the way from Ghana. And he's here to talk to us about pediatric kidney disease. Hello, Reverend.
Hello.
How are you?
I'm blessed.
We thank God. You are welcome to Akoko Africa Radio UK, and this is Health Talk with Atswei. Please, can you introduce yourself to us a little bit so we know your background and everything?
Okay. Thank you for the opportunity. So, I'm Reverend Dr. Sasu. I'm apparently at Kwesi Teaching Hospital, and I'm a pediatrician resident, a second year, and I base in Ghana, in Accra.
Okay.
Thank you.
All right. Thank you very much. So, you decided to talk about pediatric kidney disease today. I must ask, why this particular topic?
Okay. Thank you. Yeah, so first of all, we are in the month of March, and the month of March on 14th is accepted by WHO as World Kidney Days.
Okay.
World Kidney Day. Yes. So as health workers, we block the whole of the month of March to educate the public on the realities of kidney diseases. And me, from the background as a pediatrician, when we talk of kidney disease, most people are looking at the adult population.
Yes.
Yes, but being in the pediatric environment, we have a very good number of our children who either come with kidney disease or they come to the hospital with other conditions that eventually end up with kidney diseases.
Okay.
So we chose this topic to create the awareness that kidney diseases is rare in children.
Okay. All right.
Yes.
Thank you very much. So what would you say is kidney disease? How would you define kidney disease to us as layman person to understand?
Okay, thank you. So when we talk of the anatomy of the human body, the kidneys are a pair of organs. So there are two. We have the left and the right kidneys. And these pair of organs are situated just beneath your ribs. So the last rib, which usually is the 11th and the 12th one, mostly floating. So just beneath those two, then are the kidneys. So to the layman, where you have your umbilicus, just upwards between that place to where you can feel your last rib. That is where these kidneys are situated. And the size of each kidney, though in literature, it found that the left kidney is relatively bigger to the right one because the right one shares border with the liver.
Okay.
So the liver, one way or the other, pushes it down. So the left kidney is relatively bigger. So the kidneys are responsible. So to the layman, we say that the kidney is responsible for filtration. So it filters the body, as in whatever we eat, whatever we drink, even including the food we eat, contains a bit of toxins, that's poison. So it is the role of the kidney to get rid of all these poisons from the body.
Okay.
And even in a state of excessive fluid accumulation in the body, it is the role of the kidney to ensure that the excessive fluid are removed by urinating. Yes. So the core function of this kidney is to maintain the normal level of fluid in the body and to ensure that any poison or toxins in the body are excreted out to keep the body in balance.
Okay. Reverend, if you can move a little bit to your my right, this side.
Okay.
Yeah. Perfect. Thank you.
Is it okay?
Yes, that's fine now.
Okay.
Okay. All right, so we are listening.
Yes. So that is the role, the major role, and apart from this function, that is the homeostasis and homogenesis. So the kidney is also responsible for producing vital hormones in the body. Hormones which are responsible for red blood cell maturation.
Okay.
So we say that they produce erythropoietin, and the role of this hormone is to ensure that the immature blood cells that are produced in the bone marrow are matured. And then it also helps with vitamin D secretion. So in a way, the kidney plays vital role. So apart from the filtration of fluid, solutes, and waste products, it's also involved in homogenesis, producing hormones to ensure that the body doesn't lack these great hormones in their function.
Okay. Okay.
Yes. And then it also helps with acid balance in the body. So the body functions within a normal range of acid. If the acid level in the body is too much or too low, it affects the physiology of the body.
Okay.
Yes.
Oh.
So apart from this, as I said, the hormone level calcium, talk of phosphorus, metabolism. All these things are ensured via the kidneys.
Okay.
Yeah.
Okay, so in effect, if your kidney is not working properly, then you are in a big trouble because all these things will not be working well. Okay.
Exactly. The
Okay.
most important thing is the fluid balance, and then the toxins that are produced in the system.
Okay.
And that is why if your kidney shut down, then definitely a device is needed to function artificially as a kidney, and that is dialysis.
Okay.
Because of the essential role that the kidney play in the body.
Okay. All right.
Yes.
So, Doctor, how common is kidney disease in children? How common is that?
Yes, so the recent literature we have talk of the United States of America, though about 10,000 of the children and adolescent population have end-stage kidney diseases.
Wow.
And yes, and this unfortunately globally is increasing every now and then because of our lifestyle, because of exposures to toxins, and when we come to the sub-Saharan Africa, common things such as malaria. So in the West Africa or the sub-Saharan region, about 50% of patients that report to the health facilities with complicated malaria, about 50% of them end up with acute kidney diseases.
Oh.
And common infections in body, infection that causes people to vomit, diarrhea. So once you are losing fluid in your body and they are not replaced, it can easily trigger you into acute kidney injury.
Okay.
And especially now with toxins such as the mercury from the galamsey site, and all these toxins are now increasing the burden of acute kidney diseases in our facility. And unfortunately, most of this are pediatric population in the peripheral facilities do not get the proper management. So by the time they are referred to the bigger institutions such as Kolebu, where I'm currently by the time they are coming, the kidneys are affected.
Oh, it's too late for them. Yeah.
Yes, and you know, most of these are water bodies which are infested with schistosomia.
Oh.
That is flies in the water bodies. All these are sources of kidney diseases in children. So it is very, very high as far as the incidence and the prevalence is concerned. And as I said, it is rather on the rise. It is increasing. And this is attributed to the low publicity. Yes. And unfortunately, by the time these patients come, they are in the end stage.
Oh, that is very bad, isn't it?
Very.
Oh, okay.
Very.
Would you say, like, what kind of children? Which children do not normally get that? Is it like, I'm talking about, like black or white or male or female? Like, which of the children are more likely to get it?
Yes. So as part of the risk factors, it's uniform. But the thing about the Western country is that because of the proper primary healthcare system, the the
Hello, I'm listening. Sorry, I'm listening. Sorry.
Can I go ahead?
Yes, please.
Yes, so because of their proper primary health care system, most of the things that causes, the basic causes are managed well.
Okay.
So they don't end up with the chronic or the end stage where the need for dialysis.
Oh.
And even if the need be, most of their facilities are equipped with modern dialysis. And as I said, these injuries in the children are reversible. So the most important thing is diagnosing it on time. So once it's picked up early, and even in the end stage, once you put them on the dialysis, then there's a high probability that the kidney will be corrected and it will come back to its function.
Okay.
But unfortunately, in our settings, where it's only, there are only few dialysis in even bigger facilities like Kolebu. And even with that, the priorities are given to the adult population.
Yeah.
Yes. So all these things are factors that gives us the poor prognosis of acute kidney or chronic kidney diseases in children.
That makes sense, because I asked that question because I heard somewhere that black children get it more than their counterpart white children, but then this makes sense why it would be like that. So
to talk about the common causes, so there is also a genetic rule here, and then there are also causes such as cancer. So children with genetic disorders or children with genetic predisposition or cancer diseases such as Wilms tumor and even abnormality of the urinary system, that is the urinary tract system, congenital abnormality of the kidney, of the ureters, of the bladder. All these things are risk factors.
Okay.
Yes, so like I said, all race, there is no bias here. Yes.
Okay.
But the most important thing is taking it early and then making a proper diagnosis and instituting proper management to reverse it, those that are reversible. But there are some too genetically, that one you just have to manage it. They are non-reversible.
Okay. Hi listeners, you are still listening to Akoko African Radio UK, and this is Health Talk with Atswei. We still have Reverend Dr. Samuel Sasu here. So far, we are learning a lot. Reverend, please, how is it diagnosed? How is the kidney disease diagnosed?
Right. So it always starts with the presentation. So in the children, or even in the general population, once there is blood in your urine, you wake up in the morning and you see facial swelling.
Okay.
And then you see that with time, the volume of urine production is coming down. And with some of the causes, like nephrotic syndrome, you see that with time, your urine tends to foam on the surface. So when you see some of these signs, early morning facial swelling, hematuria, that is blood in urine, you see frothy urine. When you see some of these symptoms, it's call for worry. And you need to seek medical attention. So once you come to the hospital, then we start, depending on your presentation, then we start the investigation.
Okay.
So let me reiterate it. General body swelling. When there is changes in your urine color. So you see that your urine color is changed. Your urine color is now deepening, becoming as deep as cola-like urine, or as dark as Milo beverage. Once you see a change in color of your urine, means it's a red flag. And once you see the volume of urine produced gradually coming down, and sometimes you even have to strain. You have to strain to void. That is strain to void. You have to strain to urinate. And sometimes when you urinate, you still feel that there is some volume of the urine that is still in the bladder. That is residual. Yes. And sometimes it's not always the facial swelling, but sometimes can be abdominal distension.
Okay.
Yes. So once you see some of these changes, it's a red flag, and you need to report to the nearest hospital. And once you come to the hospital, then the investigation as part of the management, right from your history, your examination, your investigation, then we see the primary cause. And then the primary cause is dealt with. Because most of them, once you deal with the primary cause, they are able to reverse, especially in the pediatric population.
Okay. So these symptoms are the same both in adults and kids?
Yes, very, very.
Okay.
Very, very. Yes, so with the adult population, you see that with time, the volume of your urine gradually goes down. And the change of urine and all these things. So it's almost the same in both the adult and the pediatric population.
Okay. All right. Thank you very much, doctor.
You're welcome.
So how is this treated? If you go and then they found out that you have it, how is it treated?
Good. So like I said, early diagnosis, better prognosis.
Okay.
So once you see changes in any of the symptoms I mentioned, and you report early in a health care facility, then a diagnosis is made. So then it depends on the stage of and the extent of injury to the kidney. Yes. So we say it's acute kidney injury if the injury or the insult to the kidney is less than 3 months.
Okay.
And in acute kidney injury, the size of the kidney is not affected. But in chronic kidney disease, the size of the kidney is mostly affected. It shrinks in volume, in size. Yes. And then in acute kidney injury, it is reversible. Whereas in chronic kidney diseases, it's irreversible.
Okay.
And most of the acute kidney injury, depending on the stage of the extent of injury, so we use what we call the blood urea creatinine and then electrolyte. So we use that one with your height to calculate the glomerular filtration rate. And based on that, we have classification. And that classification, together with the volume of urine you produce, determine whether there will be a need for dialysis, or with some medication it can be reversed. And and then another thing I didn't mention, both in children in adult population, high blood pressure is one of the commonest presentation. Yes, so once there is high blood pressure, it's also an indication or a red flag. Yes, so we are able to use all these presentations to investigate, to know, number one, the probable cause, and then number two, the state or the level of injury. And then based on that, we institute the management plan.
Okay.
Sometimes can be multidisciplinary, because sometimes you need even the dietherapy, you need a nephrologist, sometimes you may even need the surgeons. So it's multi diversion. So depending on what the patient is presenting and the clinical findings, then we institute we tailor the management accordingly.
Okay. So some at some levels you can just be okay with medication.
So as I said, when you come to the pediatric population, the commonest cause, as I told you, is anything that affects your fluid intake. Because a chunk of the blood totality go to the kidneys. And once that is compromised, the kidney is going to be affected.
Okay.
So anything that will cause you to lose excessive fluid in your body and cause the kidney to reduce the volume of blood or fluid, then eventually it becomes an injury to the kidney. Yes. So, like, once there's malaria, the patient, the commonest symptoms, vomiting, nausea, vomiting, and if it's an infection, let's say gastroenteritis with diarrhea, vomiting, and all these, you are losing fluid in your body. Yeah, so once you are losing fluid and you don't get the timely intervention, then the kidney definitely will be affected.
Okay.
So once they come to the health facility and we realize most of them being dehydrated. So once you see that, you assess and know the exact cause, and we are able to treat the cause of it, then there is probability of the kidney reversing.
Okay.
But so that is pre-renal. But there are also some injury to the kidney itself. That is the intrinsic aspect of the kidney, the kidney parenchyma. That is the kidney itself. So that one too, once you come out, sometimes may even be renal biopsy to determine the exact cause of the kidney injury. And then the post-renal commonest is obstruction. So benign BPH or obstruction sometimes can be a calculus obstructing the urinary flow. So all these things are the primary causes. So if you are able to identify the cause, like if you are able to identify the cause, then you institute the proper management.
Okay.
But like I said, it is not all of them that are reversible. Sometimes, like the congenital abnormalities, like those with cancer, like those with genetic disorders. So those ones we manage it.
Okay.
We can't treat it. So we just manage the person.
All right.
Yes.
Okay. Thank you very much. So when there's a kidney failure, when the kidney fails, how is that treated?
Okay. So the kidney failure, that is the end stage kidney disease. So it means that here the kidney is not able to remove all the toxins that are produced in the body.
Okay.
And all these toxins will be stored in the body and they will affect the physiology of the body. It means that the acid level of the body cannot be maintained within the normal range. It means that the body state will be affected. And that is when you need an artificial replacement.
Okay.
That is the renal replacement therapy. And it is either hemodialysis or peritoneal dialysis.
Today
So
we are
that is
learning
when-
a lot of words.
Yes, so that is when you need to put the patient on a machine, so that the machine then here is going to do the function of the kidney. So it's acting as an artificial kidney, so that it helps with the removal of the toxins. It helps with the removal of the acid. It helps with the removal of the excess fluid from the body. And then here it means that because the erythropoietin, that is the chemical responsible for the maturation of the blood cells, is also affected. It means that such a patient is going to need regular blood transfusion.
Okay.
Yeah, so as part of the dialysis, the machine is able to take out the blood from the body with all the toxins and replace it with a fresh blood without any toxins.
Okay. So that's what
Yes.
dialysis means.
Exactly.
Okay.
Exactly. So apart from removing the toxins from the body, it also brings in new blood, and then the toxin blood or the poisonous blood are removed from the body.
Okay.
So essentially, that is the role of the dialysis.
So how often is one supposed to be going through that, in like a week or a month or so?
Okay, so we start them weekly, and as we do that, we assess the prognosis. That is assessing the responses of the kidney to the dialysis. Yeah, so those, like you said, those with the kidney failure, and it is chronic. When it is chronic, then it means that it is irreversible.
Okay.
So it means that those patients are going to be on the dialysis probably for the rest of their
Their
life.
lives. Okay.
That so these people are scheduled mostly weekly. So they come on weekly basis for the dialysis. So it means that the function of the kidney is now done by the dialysis machine.
Okay.
Exactly.
So such a person, can they be like live a normal life, travel and everything, as long as they are coming there for their weekly dialysis?
Exactly.
Okay.
Once we stick to the course of the management, whether acute or chronic. and you are on regular checkup, though it's going to affect your lifestyle, such as your eating habits and all these. But once you are able to stick within the proper way of management, then it means that, yes, though some of them end up dying probably earlier, yes, but there is high probability that being diagnosed with kidney failure is not equal to end of life.
Okay.
It's not a death sentence, especially in the pediatric population.
Okay.
Once we are able to pick it up early and institute the necessary management, even if it is a chronic one, such a child, like I said, depending on the stage of the kidney, that determines the prognosis and the life expectancy of such patients.
Okay, thank you very much, Doctor. You are still listening to our Coco Africa Radio UK. This is Health Talk with Atswei. We still have Dr. Sasu here, and he's telling us much about kidney diseases in children, things you need to look out for, and when it's time to see the doctor. He has mentioned if they are diagnosed early, it means it can be what do you say? It can be treated early, yes, and then it can be fatal, yes.
And then it will revert to the normal function.
Okay.
Yes.
Okay. So, Dr. Sasu, how successful is kidney transplant?
Yes, so kidney transplant in the developed countries, yes, in the Western world, so there are literature, even almost about 80% of both the children and the adult population with kidney failure. So once they start them with the renal replacement, that is the dialysis, and they are not making it, or they are not progressing, then at a point a transplant is discussed.
Okay.
Yes, so with a transplant, there are a lot of factors.
Okay.
Yes, whether it's you are going to get a donor from your family, because there are compatibility.
Yeah.
Apart from blood, there are also other enzymes and other important factors.
Okay.
Yes, so because having the transplant is not 100% success, because there can even be future rejection.
Rejection, yeah.
But sometimes your body can even fight it.
Okay.
Yes, so it's seen medically that identical twins tends to do better if a recipient is receiving from a twin.
Okay.
So even with that, identical is better than fraternal. And then you come to immediate family, that is your siblings, your parents. Yes, because of the identity. So genetically, it means that there are a lot of things you share in common with that, with both the donor and recipient.
Okay.
Yes, so the probability of your body to see it as a foreign minimizes.
All right. Okay.
Yes.
It makes sense.
And so that is it. And then apart from that, you are looking at a donor who doesn't also have any chronic disease. So the person must be screened with HIV, hepatitis, and other infections, which in the long run can go against the recipient.
Okay.
So all these things are put together. But the truth of the matter is that, as I said, in the Western population, because of their sophisticated equipment, the prognosis is always better than our part of the world. Yes, because as we speak now, Ghana, here in Kolegu, and even with that, yes, when there is a need for kidney transplants, now most are done in South Africa.
Oh, so we don't do it in Ghana?
It's recent that some of our surgeons have started, like most of them in training, but now have started practicing. So it's not a common practice here.
Okay.
And it's such a complicated surgery.
Okay.
So we look at the pros and the cons.
Okay.
Yes, so okay.
So we don't do it in Ghana. Is it because we don't have the surgeons, or we don't have the equipment, or what is the problem?
Yeah, so it's very, very sophisticated, both with equipment and then even with affordability.
Okay.
Yes, so the very few who are able to afford will prefer doing it outside. But like I said, now in the teaching hospitals like Kolegu, Komfanoche, some of the surgeons have started, because now it's progressively increasing. Yes, so some of the surgeons are looking into this, and they are still on trials looking at this.
Okay.
Yes.
So I'll ask you about Ghana because you are there at the moment. With the dialysis, do we have like enough dialysis machines there? If somebody is on dialysis in Ghana, would you say it would be okay for the person? Do we have enough dialysis machines there?
Yeah, so that's also a major challenge because recently in Tamale Teaching Hospital, about 15 children, that is the pediatric population, died because there was no dialysis center there.
No.
And when we talk of dialysis, you can only talk of Komfanoche, you can talk of Kolegu Teaching Hospital. I'm not sure about Cape Coast, but it's, and even in Kolegu here. So as part of our advocacy as pediatrician, so what we have here in Kolegu is for both the adult and the pediatric population.
Oh, it looks like we've lost Dr. Sasu. Okay, he's back.
Hello?
Hello. Yeah.
Hello?
Hello. We can hear you
Can you
now.
hear me, please?
Yes, please. We can hear you now.
Yeah, so even in Kolegu here, what we have here is catering for both the adult and pediatric population. And sometimes it's biased towards the adult population. So as part of advocacy program, that is what we as the residents are looking at, so that we are able to operationalize for the pediatric age group.
Okay.
Yeah, because sometimes the hello?
Hello, I'm listening.
Yes, please. Because sometimes the adults are given the preference, and these young ones with life mostly do not get opportunity, and sometimes even must be in queue.
Okay.
Yes, because of the ratio, the number of the dialysis machine to the population.
Okay. That's not
Yes,
fair,
so
isn't it?
yes, exactly, and that is what it is on the ground.
Okay.
Yeah.
So what would you say, like, what life healthy, how do we keep our kidneys healthy? I mean, in kids, I don't know what can be done, but like in adults, or is there something we can do for the kids as well?
Right. So, like I said, the commonest causes, what the fluid we take in, it's very, very important. So, an adult, if nothing at all, at least 3 liters of water a day.
Okay.
And then, in the adult population, the commonest risks is smokers and alcoholics. Unfortunately, in Ghana now, most with our leaders on the market, and most of these are serious nephrotoxins, that is poison to the kidneys. And it is the responsibility of the kidney to get rid of all this poison from the body.
Okay.
So at a point, the kidney can be overwhelmed. So it is very, very important that some of these risk factors are looked at.
Okay.
So adequate water intake. And then once there is an infection or infestation, it's better you always seek for adequate medical treatment.
Okay. All right.
And you don't go to the pharmacy to get over-the-counter medication, because anything we take into the body contains some level of poison.
Okay.
Yes, so if you go to the drugstore and you just walk in there, you buy any medication there, the group of medicine that are very stressful to the kidney.
Okay.
And then as part of our settings, the common practice, which is herbal medication. Herbal medication is very, very common practice here.
Yeah.
Yeah, so it's also an important thing we look at. And then as part of advocacy, it is high time we look at our water bodies. The pollution is too much.
Okay.
Because these high metals are enemy to the kidney. The mercury they use for the galamsey and all these things are very poisonous to the kidneys.
Okay.
And then, as I said, once you see any of the signs I mentioned, early morning facial puffness, abdominal swelling, you see blood in your urine, you see a change in color of your urine, once you see that your urine volume is coming down, please rush to the nearest hospital.
Okay. Thank you very much, Doctor. I have
You're welcome.
a few questions here for you. Is alcohol bad for your kidney? Somebody wants to know if alcohol is bad for the kidney.
Okay, thank you. So I mentioned it as one of the risk factors, especially in the adult population. So alcohol broken down contain that is ethanol.
Mm-hmm.
And it's a chemical. And it needs to be cleared from the system by the kidney. So excessive exposure to the alcohol is a wreck for the kidney. Yes, and it's one of the commonest risk factors that really can push the kidney into an acute injury.
Okay.
So the volume, the frequency is very important.
Okay. Thank you very much.
Yeah.
Thank you. And then there's another one. Can your kidney repair itself?
Good. So the body itself have a way of once there's distraction. But it depends on the exposure. If the exposure or the insult is excessive, then it becomes difficult for the body to bail itself out.
Okay.
Yes. So we take in a whole lot of things, from food to things we take in, drugs, and a whole lot of them. And most of them we don't see the effect because the body is able to deal with it.
Okay.
But when it is in excess, when the exposure is in excess, then it becomes a problem
Okay.
for the body to handle it. That is when we are taken into the acute phase of it. And if the acute phase is not diagnosed early or not managed well, then it takes you into the chronic phase.
Okay. So can one function with one kidney? Like,
Yes. And of course, if somebody is going to donate to the other, it means that the person is going to end up with one.
with just one.
Exactly. And that is why it is important for us to ensure that both are safe. It is almost like your two eyes. At least if you lose one, the other will be able to
see.
function. Yes. But if you've lost one and now you are dependent on only one and you lose the other one too, then you are thrown into a disaster.
Of course. All right.
Yes, so you can survive on one
kidney. Okay.
Yes, and if you take care of it well, you would live your normal life, and your life expectancy, you achieve it.
Okay, thank you. Oh, I've got so many questions here for you. There is another question. Someone wants to know if they can go on holiday if they are on dialysis. And for how long?
On holiday?
Yeah.
Yeah, so I said once it's diagnosed and we start you on dialysis, we do like follow-up labs. Yes, so then once we see the improvement is increasing, then even your visit to the hospital is relatively prolonged.
Okay. All right. Seems we have having network problem in Ghana. We can't hear Dr. Sasu.
Hello.
Hello. Yes, it's back now.
Hello.
Hello. Yeah, the line went bad a little bit, but we can hear you now. Yes.
Okay. All right.
All right.
So what was the last thing you heard?
You were talking about going on holiday. That's the one we're talking about. How if
Right.
Hello.
Hello.
Yeah, can you hear me? Yes. So you were telling us,
Yes, I can hear you.
yeah, how someone can go on holiday if they are following the procedures and everything.
Exactly. Exactly. So we monitor it, and then as it gets better, we prolong your visit for review. Yes, and with all the necessary precaution, why not? You can go on holiday, and yes, when your time is due for review, you come.
You come, okay.
Well, it's not a life sentence. It's not a death sentence.
Yeah. Someone wants to know if dialysis is affordable in Ghana. I know you've already spoken about that, but is it?
Yeah. So apparently for a section that is previously it was 200 and something Ghana cedis, but just I think within a month or two it's been increased to 300, almost getting to 400 Ghana cedi per session.
Per session?
Yes.
Oh.
So if we start you on the dialysis, and in a week you are doing 3 times of it, then it means that you are looking at more than 1,000.
Oh God.
Yeah.
That is expensive. That is expensive.
It is for the ordinary Ghanaian.
Yes.
It is.
Yes.
It is. And unfortunately, most of our clients are not able to afford, and sometimes it even pushes them for them to be discharged against medical advice.
Oh no.
They are telling you they want to probably resort to alternative
Like herbal.
and it kills them. It kills them because the kidney already is under stress, and by introducing all this herbal thing, it's really a problem.
No.
Just a minute.
Okay. Okay. All right. So you don't get any support from like maybe some rich people or prominent people in the country. Is there any support? Or how can we? I mean, it's sad. It's sad if somebody cannot afford and they have to die because of finances. Yeah.
Yeah. So recently, it's even a debate that where the masses are calling on the government to inculcate that into the national health insurance scheme.
Okay.
Yes, that one. In the meantime, I don't think it will fly.
It will.
It will probably take us a long time to get there. Yes, because already it's inadequate, and even the few ones we have here, there's always competition for it. So if you don't have money, somebody with money
will take it. Yes.
Exactly.
This is sad.
Somebody with money will take it. Yeah. So as I said, as part of our advocacy program as pediatrician, we are looking at. So we have a donation from a badge that is a year group of the Wesley girls from senior high school.
Oh, okay.
And yes, at the pediatric intensive care unit, we have the dialysis machine there, and now we are looking for sponsors so that we put everything together to start the operation of this dialysis machine in a pediatric intensive care unit.
Okay.
So that it reduces the burden of the pediatric population on the adult center.
All right.
So yes, I will use this medium to call for support people that are interested to help us. Yes, to partner with us to ensure that this is operationalized. It will go a long way to save the innocent life of our children.
Okay, so if someone wants to help or support, how do they contact you? Who should they contact?
Right. So after the show, probably I'll send you the details so that yes, you use this medium to help us with the publicity.
Okay.
Because we are really looking at starting this because recently there was a child on our ward. We had to, and this child was just 2 days on our ward, and we had to, was in acute kidney failure, and we had to send to the dialysis center. And I'm telling you, we went through. It was hectic. I mean, moving this child was already ill, critically, and moving this child from one place to the other. Unfortunately, we lost her.
Oh no!
Unfortunately, yeah, this is I think 14-year-old girl, and seeing this young girl full of life, I mean, dying because of the timely intervention, it's crazy. So we are really looking up and calling for people to help us. Yes, at least we have the pediatric intensive care unit, and the machine already is there. So we've consulted people who have, put some few things together, and we are looking at raising some money. So I'll send you the details.
Okay.
So that benevolent people, yes, who would share in this vision to save the life of these innocent children in our population. Yes, and I believe by God's grace, it will go a long way to bless them.
Thank you very much. Thank you. And in kidney donation, it said that black people don't like to donate their kidneys. Is that true, or is this all round?
Yeah, so like I took you through the transplant process. So it is always better. We talk of homologous, that is the proximal you are to the person, that is between the donor and the recipient, the more it increases the chances for survival.
Okay.
So if it's within your immediate family with almost same genetic composition, it makes it, it increases the chance of survival. Because even after the transplant, sometimes the body can fight it severely. And after all these huge expenses, getting the transplant done, then within a short time, sometimes 1 year, 2 years, the patient still die because of this reaction.
And then you can't give that kidney back to the donor.
Okay, so with that one, I think I may have to check the literature to be sure.
Okay.
Yeah. But to declare somebody dead, yes, to declare somebody dead, there are vital organs that you need to look at. The brain, the heart, very, very, and then the lungs, very, very crucial. So if at the time of declaring the person brain dead, and some of these vital organs are still functional, then they can be harvested.
Okay.
Yes, then they can. But I think it's better in the developed countries, in the Western countries, than here.
Here, okay.
Yes.
All right.
Yes, we are now looking into all these things.
All right.
Yeah.
Thank you so much, Dr. Sasu. Oh, someone just came on now, said, how do we prevent it? I think they missed out when you were talking about that.
Yeah. So prevention is always the cure. So please, with all eagerness, let's protect our kidneys. And how do you protect these kidneys? Adequate fluid intake, that is water. Our body is made up about 60% of water. And anything that will cause you to lose fluid in your body can affect the kidney.
Okay.
About 20% of the blood in our system go to the kidneys alone. So anything that will cause you to lose blood, like an accident that will cause you to pour out blood excessively, or anything within that will cause you to lose blood, will definitely affect the kidneys. And then the intrinsic one, the thing that we take in, that is the anything poisonous to the body, alcohol, tobacco, and then the herbal medication. And then, like I said, in our settings here, with the advent of this high galamsey site, releasing toxins, high metabolic toxins into our water bodies.
Okay.
So all these are ways of exposing the kidney to severe injury.
Okay. Thank you very much. So, Dr. Sasu, in your line of duty, has there been a time you have to declare a patient dead because of kidney failure, and how does it feel?
Oh. Yeah, so it's not a pleasant thing. It's not a pleasant thing. And most of these things are in a way preventable or manageable, but because of inadequate resources, and you see innocent life dying because of some of these things are very sad and pathetic. Very sad and pathetic, because we are not given, and me speaking as a pediatrician, we are not giving this our children the full potential to explore. They are God-given capacity or ability. It's not a pleasant thing. We see parents who have been with their children, I mean, from cradle, like this case scenario that I told you. It was a 16-year-old girl in senior high school. It's not easy.
Very disheartening.
Very, 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 very. And sometimes you need to even go back and wipe your own tears, even as a practitioner. Because sometimes all these things are due to systemic failure. Yes, it's a failure on our part to bring our people to this far. Because as like a nation, as a people, by this time we ought to have gone ahead as far as medical. Yes, and Ghana, medically it's not bad, but mostly it's logistics.
Okay.
The things to work with. Yes, the equipment. These are the challenges.
Wow.
There is no pleasant situation.
Thank you so much, Dr. Sasu.
You're welcome.
We've come to the end of the show, and I just want to ask you if you have anything else you want to tell our listeners before you leave us.
Okay, thank you. So, kidney diseases, they are where they are happening, and especially in the pediatric population, kidney disease is rare. Kidney disease is not just in the adult population. So please, as a parent, a senior sibling, or even a caregiver, once you are there with a child and you recognize the symptoms I shared with you, general body swelling, facial swelling, abdominal swelling, pedal edema, that is swelling of the feet, or you see that now the child have challenge in urinating, urinate with pain, or have to strain to urinate. There is change in urine color to cola-like or Milo beverage color, or like a malt color. Yes, anything that causes the change in urine color. Sometimes they can even urinate blood, like you see red blood itself.
Okay.
So anytime you see any of these, means it's a red flag. Bring that child to take that child to the nearest health facility so that the proper investigation are carried out. Early diagnosis is better prognosis.
Wow. Thank you so much.
And yes, please.
Thank you.
So let's ensure that we keep our population and our environment safe. And I'm using your platform. Please, let's be vigilant in our environment, wherever you find yourself. Anything that pollutes our environment, especially our water body. A typical example here, the galamsey practice. Look, we are all advocates because we all drink from one source. And once our water bodies are contaminated with heavy metals, then we are all at risk.
That's
So
true.
please let us rise up against the illegal way of mining. And let's keep our population and society safe. God bless you all.
Thank you very much. So, Dr. Sasu, you being a reverend minister and a doctor, how do you combine this and this hectic job you are doing now?
Yeah. So as I'm talking to you, I'm still in the hospital, and the scene will go on tomorrow Sunday morning. I will go to church, preach, and then come back to the hospital because I'm on weekend duty.
Wow.
Yeah, so it's a calling.
Well done.
It's a passion.
Well done. I'm sure God will reward your efforts. And thank you so much that when we called you, you honored our invitation, and we've learned so much. I'm sure our listeners have learned a lot as well. And we all, in our own small way, try to propagate this information and help each other to prevent all that is going on. And since you said you will give us your details, we'll put it out there, and if there's anyone who wants to support in any way, we'll do our best in our own small way to help support that. Thanks so much from all of us here from Akoko Africa Radio UK, and we hope you will come back again soon, even though we know you are very, very busy. Whenever you have any time. Yes. Mass education is very important.
Yes. And as healthcare practitioners, education, counseling is part of our responsibility. So anytime you call on us, we will make ourselves available.
Thank you. You are always welcome here. So whenever you are ready, let us know. And our listeners like to hear more from you. They like to see you come back. So thank you, and bye-bye from us now. You have a nice weekend. Bye.
You too. Bye.
Hi, listeners. So you are still listening to Akoko Africa Radio UK. This is Health Talk with Atswei. All too soon, we've come to the end of the show. I hope you've learned something from what Dr. Sasu have taught us today. Let's look out for each other. And if there's anything you don't understand in your body or something, just don't wait. Find a practitioner and have it checked out. And let's all come together and help support the pediatric section in Ghana. Not just that, but there are other sections in Ghana that they need help. Every little help in our own small way. Let's do what we can to help each other. If you found this information, don't keep it to yourself. Share it with other people so that we can get a lot of people aware of what they should do when they have some of these symptoms. Thank you. Hello everyone. Before I leave you, this is just a little quote from me. Kindness is a language which the deaf can hear and the blind can see. Always be kind to one another. Have a wonderful weekend. There will be no Shepherd's Hour tomorrow and no Kobe show as well. Enjoy your weekend, and hopefully next week we'll see you. Oh, next week is Easter, isn't it? So there won't be anything on next week. After Easter, we'll come back. Have a wonderful Easter, and see you after Easter. Bye from us now.
Health Talk Show with Atswei, your health our priority. Health Talk Show with Atswei, your health our priority.